So I really don't think where I was that we did have a particular shortage with PPE. Um, my trust, I mean, my trust now has its own PPE factory, which is good. But I don't think where I was working in particular there was a huge shortage. I think nationally there was a perceived shortage, and I think that it did. People were very scared at the time. People were very anxious about what the virus was going to be, what their lives were going to be. There was a big unknown about it. And I think some of that fear was possibly channeled into there's a lack of PPE. But really, I didn't feel that there particularly was. I did sort of look around at staff and sort of felt that we could have been better at how we used the PPE. So, for example, a little bit later on in the pandemic, the Royal College of Physicians London produced an infographic called Spaces, and that was about sharing patient assessment in order that you reduce how many times you're going into a patient room. And I think in the very early days, we hadn't quite adapted our practice. So I would see consultants going into a room, bringing the FY1 with them to see the patient, which they do because they always do that, and it's a learning opportunity. But I just had to stop and challenge that and sort of say, is that really necessary? Is it necessary to bring the F1 in with you? And when I did my ward rounds, I had a mechanism where I went in with the PPE, my SHOs stood outside, I would come out the room and then dictate what I wanted that person to write in the notes. There's pros and cons with each approach, but at the time, in order to preserve and use PPE most effectively, I felt that there were ways that we could have implemented a little bit earlier in order to sort of use it more intelligently. But I absolutely accept that behaviour change is incredibly difficult. And, humans are animals of routine, and often things just happen because they're not necessarily thought about in advance.
And you mentioned that your trust has a factory for PPE. Was that something that was in place long before COVID?
No. So that was put in response to during coronavirus. So I think they're obviously on the global market. PPE was available, but was available at a cost, and those costs did escalate quite rapidly. And I think so. The trust I work for it's an interesting trust. So it's one of the few trusts in the country that are not in debt. And so it is a trust that is quite dynamic and creative in how it gets revenue. And obviously revenue is really important for trusts to make, because any profit you make you can actually reinvest in your services. And so quite early on, it started producing PPE, mainly so that we had a reliable access to it, but could also use that revenue to reinvest in stuff that we need.